CEN Exam Prep Ebook. Question 1. A patient with an open fracture of the tibia is brought to the ED. What is the priority nursing intervention? Option A. Administer 4 antibiotics. Option B. Cover the wound with a sterile dressing. Option C. Check distal pulses and sensation. Option D. Apply a splint. The correct answer is option C. Check distal pulses and sensation. In any fracture, especially open fractures, neurovascular assessment distal to the injury is the priority. Checking pulses and sensation ensures there is no vascular compromise or nerve injury. For antibiotics, A, wound dressing, B, and splinting, D, are important but secondary to neurovascular assessment. Question 2. A patient with increased intracranial pressure is at risk for Cushing's triad. Which of the following comprises Cushing's triad? Option A. Hypertension, bradycardia, irregular respirations. Option B. Hypotension, tachycardia, tachypnea. Option C. Hypertension, tachycardia, Cheyne-Stokes respirations. Option D. Hypotension, bradycardia, hypoventilation. The correct answer is option A. Hypertension, bradycardia, irregular respirations. Cushing's triad is a late sign of increased ICP, indicating herniation is imminent. It consists of hypertension, widening pulse pressure, bradycardia, and irregular respirations. This compensatory response is the body's attempt to maintain cerebral perfusion. Question 3. A patient presents with the following symptoms: butterfly rash on the face, joint pain, and photosensitivity. What is the most likely diagnosis? Option A. Systemic lupus erythematosus. Option B. Rheumatoid arthritis. Option C. Scleroderma. Option D. Sjogren's syndrome. The correct answer is option A. Systemic lupus erythematosus. Systemic lupus erythematosus, SLE, commonly presents with the classic butterfly, malar, rash across the cheeks and nose, joint pain, photosensitivity, and other systemic symptoms. Rheumatoid arthritis, B, presents with joint deformity and morning stiffness. Scleroderma, C, presents with skin thickening. Sjogren's syndrome, D, presents with dry eyes and dry mouth. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents with a temperature of 101.4 degrees Fahrenheit, heart rate of 110 beats/min, and respiratory rate of 26 breaths/min. To consider if the patient may have sepsis, the nurse should assess if the patient has: Option A. A possible infection. Option B. Positive blood cultures. Option C. An immunocompromised state. Option D. Been febrile over 24 hours. The correct answer is option A. A possible infection. According to the current definition of sepsis, a patient with signs of infection, fever, tachycardia, tachypnea, should be assessed for a possible source of infection. Sepsis is defined as life-threatening organ dysfunction caused by a dysregulated host response to infection. Positive blood cultures, B, are not required for diagnosis. Immunocompromised state, C, is a risk factor. Duration of fever, D, is less relevant. Question 5. A patient with Crohn's disease is at increased risk for which complication? Option A. Toxic megacolon. Option B. Intestinal obstruction. Option C. Perforation. Option D. Fistula formation. The correct answer is option D. Fistula formation. Crohn's disease is a transmural inflammatory process that often leads to fistula formation between bowel loops, skin, or other organs. Toxic megacolon, A, and perforation, C, are more common in ulcerative colitis. Intestinal obstruction, B, can occur in both, but fistula is more specific to Crohn's. Question 6. A patient with opioid use disorder presents with suspected opioid overdose. Which medication should the nurse anticipate administering? Option A. Naloxone. Option B. Flumazenil. Option C. Naltrexone. Option D. Methadone. The correct answer is option A. Naloxone. Naloxone, Narcan, is a pure opioid antagonist that reverses the respiratory depression and sedation of opioid overdose. Flumazenil, B, is for benzodiazepine reversal. Naltrexone, C, is for maintenance therapy. Methadone, D, is a long-acting opioid. Question 7. A 25-year-old female presents with acute onset of severe lower abdominal pain and vaginal bleeding. The patient states she is 8 weeks pregnant. What is the priority nursing action? Option A, administer 4 fluids. Option B, obtain a urine pregnancy test. Option C, prepare for immediate surgery. Option D, assess for signs of hypovolemic shock. The correct answer is option D, assess for signs of hypovolemic shock. The patient's presentation of pain and bleeding in early pregnancy is concerning for ectopic pregnancy or spontaneous abortion. Hypovolemic shock can develop rapidly with intra-abdominal bleeding. Assessment of vital signs and signs of shock are the priority. For fluids, A, may be needed, but assessment comes first. A urine pregnancy test, B, is unnecessary, as the patient already knows she is pregnant. Surgery, C, may be needed but is not the first step. Question 8. A patient refuses treatment and wants to leave the ED against medical advice. What is the nurse's priority action? Option A, let the patient leave. Option B, notify security. Option C, assess the patient's decision-making capacity. Option D, restrain the patient. The correct answer is option C, assess the patient's decision-making capacity. If a patient wants to leave AMA, the nurse must first assess whether the patient has the capacity to make informed decisions. If the patient is alert, oriented, and understands the risks, they have the right to refuse care. Notifying security, B, is only if the patient is a danger. Restraints, D, are not appropriate for a patient with capacity. Are you looking for CEN Exam actual questions? Visit our website pokerexams.com to access CEN Exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN Exam answer key today. Question 9. A patient has been exposed to cyanide. What is the most characteristic finding? Option A, cherry-red skin. Option B, cyanosis. Option C, slate-gray skin. Option D, flushing. The correct answer is option A, cherry-red skin. Cyanide poisoning causes a classic cherry-red skin color due to high venous oxygen saturation from impaired cellular oxygen utilization. Cyanosis, B, is seen in hypoxia from other causes. Slate-gray skin, C, is seen in methemoglobinemia. Flushing, D, is nonspecific. Question 10. A patient is brought to the ED after a violent assault. What is the first priority in caring for this patient? Option A, obtain a forensic evidence collection kit. Option B, perform a thorough physical exam. Option C, ensure patient safety and medical stabilization. Option D, contact law enforcement. The correct answer is option C, ensure patient safety and medical stabilization. The ABCs in medical stabilization are the priority for any patient, including victims of violence. Forensic evidence collection, A, physical exam, B, and contacting law enforcement, D, are important but secondary to medical stabilization. Question 11. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO3 24 milliequivalent/L. What is the most likely interpretation? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option C, respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO 2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO 2. Question 12. The nurse is caring for a patient in cardiogenic shock following an ME. Which hemodynamic parameter is expected? Option A, elevated CVP, elevated PCWP, low cardiac output. Option B, low CVP, low PCWP, high cardiac output. Option C, elevated CVP, low PCWP, high cardiac output. Option D, low CVP, elevated PCWP, low cardiac output. The correct answer is option A, elevated CVP, elevated PCWP, low cardiac output. Cardiogenic shock is characterized by pump failure, leading to elevated filling pressures, CVP and PCWP, and reduced cardiac output. Options B and C describe distributive shock, such as sepsis or neurogenic shock. Option D is not consistent with any shock pattern. Question 13. A patient presents with a complaint of severe headache and photophobia. The patient has a temperature of 101 degrees Fahrenheit and nuchal rigidity. Which triage category is most appropriate? Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. A patient with fever, nuchal rigidity, and photophobia is at high risk for meningitis and requires rapid assessment, ESI 2. The patient is not unstable enough for ESI 1A, but needs to be seen quickly. Question 14. In a mass casualty incident, which patient would be classified as green minor, according to START triage? Option A. A patient with a fractured femur, respirations 20/min, pulse 100, able to follow commands. Option B. A patient with an open fracture of the tibia, respirations 24/min, pulse 110, able to follow commands. Option C. A patient with a sprained ankle, respirations 18/min, pulse 90, able to walk. Option D. A patient with a large scalp laceration, respirations 22/min, pulse 100, confused. The correct answer is option C. A patient with a sprained ankle, respirations 18/min, pulse 90, able to walk. In START triage, green minor, patients are those who are walking and have minor injuries. The sprained ankle patient who can walk is green. Fractures, A, B, are typically yellow delayed. Confusion, D, is a concern and may indicate need for more urgent care. Question 15. A patient is brought in with a diagnosis of schizophrenia who is actively hallucinating. What is the best nursing approach? Option A, tell the patient the voices are not real. Option B, ask the patient what the voices are saying. Option C, ignore the patient's hallucinations. Option D, place the patient in restraints. The correct answer is option B, ask the patient what the voices are saying. It is appropriate to ask the patient about the content of hallucinations in a non-judgmental manner. This helps assess for command hallucinations that may be dangerous. Telling the patient the voices are not real, A, denies their experience. Ignoring, C, is dismissive. Restraints, D, are unnecessary unless the patient is a danger. Question 16. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Option A, Wernicke-Korsakoff syndrome. Option B, delirium tremens. Option C, alcoholic ketoacidosis. Option D, hepatic encephalopathy. The correct answer is option A, Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome presents with the triad of confusion, ataxia, and ophthalmoplegia, caused by thiamine deficiency due to chronic alcohol use. Delirium tremens, B, presents with tremor, agitation, and hallucinations. Alcoholic ketoacidosis, C, presents with metabolic acidosis. Hepatic encephalopathy, D, presents with altered mental status due to liver failure. Question 17. Which finding in a patient with pneumonia would indicate the need for ICU admission? Option A, respiratory rate of 24 breaths/min. Option B, altered mental status. Option C, temperature of 101.5 degrees Fahrenheit. Option D, WBC count of 15,000. The correct answer is option B, altered mental status. Altered mental status in a patient with pneumonia indicates severe illness, possible sepsis, or hypoxemia, and warrants ICU-level care. A respiratory rate of 24A is mildly elevated and can be managed on a medical floor. Temperature of 101.5 degrees Fahrenheit, C, is common with pneumonia. WBC of 15,000, D, is elevated but not indicative of ICU need by itself. Question 18. Which of the following is the earliest sign of cardiac tamponade? Option A, muffled heart sounds. Option B, JVD. Option C, pulsus paradoxus. Option D, hypotension. The correct answer is option A, muffled heart sounds. The classic Beck's triad includes muffled heart sounds, JVD, and hypotension. Muffled heart sounds are often the earliest sign because fluid accumulating in the pericardial space dampens the audible heart sounds. JVD, B, occurs as right heart filling is impaired. Pulsus paradoxus, C, is a later finding. Hypotension, D, is a late sign indicating severe hemodynamic compromise.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee A-Pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. An epidural hematoma is most commonly associated with which mechanism of injury? Option A, striking the head on a hard surface. Option B, rapid deceleration injury. Option C, injury to the temporal bone with laceration of the middle meningeal artery. Option D, acceleration minus deceleration injury causing shearing forces. The correct answer is option C, injury to the temporal bone with laceration of the middle meningeal artery. Epidural hematoma is typically caused by a blow to the temporal area of the skull, lacerating the middle meningeal artery. This results in rapid accumulation of arterial blood. Option A is too general. Option B describes diffuse axonal injury. Option D describes subdural hematoma. Question 20. A patient with a known history of aortic stenosis presents with syncope. Which medication should the nurse avoid administering? Option A, 4-normal saline. Option B, 4-nitroglycerin. Option C, 4-morphine. Option D, 4-oxygen. The correct answer is option B, 4-nitroglycerin. Patients with aortic stenosis depend on preload to maintain cardiac output through the narrowed valve. Nitroglycerin reduces preload and can cause severe hypotension and cardiovascular collapse in these patients. 4 fluids, A, are appropriate to maintain preload. Morphine, C, should be used cautiously. Oxygen, D, is safe but not the primary concern. Question 21. A patient presents with stridor and drooling. What is the priority nursing action? Option A, assess the airway and prepare for possible intubation. Option B, obtain a lateral neck X-ray. Option C, administer nebulized epinephrine. Option D, administer 4 antibiotics. The correct answer is option A, assess the airway and prepare for possible intubation. Stridor with drooling in an adult suggests epiglottitis, a life-threatening airway emergency. The priority is to secure the airway. The patient should not be agitated or have a throat examination. Lateral neck X-rays, B, may delay care. Nebulized epinephrine, C, may be used for croup but is not appropriate for adult epiglottitis. Antibiotics, D, are important but secondary to airway management. Question 22. A patient is diagnosed with acute appendicitis. The nurse is particularly concerned if the patient reports which symptom. Option A, sudden relief of pain. Option B, nausea and vomiting. Option C, right lower quadrant pain. Option D, rebound tenderness. The correct answer is option A, sudden relief of pain. Sudden relief of pain in a patient with suspected appendicitis may indicate perforation of the appendix. This is a serious complication requiring immediate surgical intervention. Nausea and vomiting, B, right lower quadrant pain, C, and rebound tenderness, D, are all expected findings in appendicitis. Question 23. Which symptom is most characteristic of a subarachnoid hemorrhage? Option A, sudden, severe thunderclap headache. Option B, gradual onset of confusion. Option C, focal weakness on one side. Option D, loss of consciousness without headache. The correct answer is option A. Sudden, severe thunderclap headache. Subarachnoid hemorrhage classically presents with a sudden, explosive thunderclap headache described as the worst headache of the patient's life. Focal weakness, C, is more common in ischemic stroke. Gradual confusion, B, is less characteristic. Loss of consciousness without headache, D, is not typical. Question 24. The nurse is triaging a child complaining of fever and rash for 3 days. The nurse notices the appearance of blue-gray spots with a red base on the inside of the child's mouth and a maculopapular rash on the face. Where would be the best location for this patient following triage? Option A, return to the waiting room in line of sight of the triage nurse. Option B, resuscitation bay to prepare for intubation. Option C, isolation room on droplet precautions. Option D, isolation room on airborne precautions. The correct answer is option D, isolation room on airborne precautions. The child's symptoms, colic spots, blue-gray spots with a red base on the buccal mucosa, and maculopapular rash, are classic for measles, rubella. Measles is transmitted by airborne particles and requires airborne precautions with N95 mask and negative pressure isolation. Droplet precautions, C, are not sufficient. Question 25. A patient with COPD is receiving supplemental oxygen. The nurse is most concerned if the patient's oxygen saturation is maintained at which level? Option A, 88-92%. Option B, 93-95%. Option C, 96-100%. Option D, 85-88%. The correct answer is option C, 96-100%. In COPD patients, the goal is to maintain oxygen saturation between 88-92%. Excessive oxygen can suppress the hypoxic drive and lead to hypercapnic respiratory failure. A saturation of 96-100% is too high and may worsen ventilation in these patients. Saturation below 88%, D, is too low.